You're pregnant. Congrats! Ah! Now what? Make sure your oral health doesn't fall astray during this time. Keep watching. So if you're feeling nauseous like I was all 3 pregnancies, and I had hyperemesis gravidarum with all 3 pregnancies, it's super duper important to first of all, give yourself grace. Second of all, baking soda water rinses are going to be your best friend, especially after bouts of vomiting. Even during the day when you're nauseous for a long period of time, it's just good to alkalize your mouth. What you do is take 1 teaspoon of baking soda to 10 to 12 ounces of lukewarm water and rinse with it. If you can gargle, great. If not, don't worry about it. Number 2, if you're snacking on crap like I was, especially when the nausea was so bad, saltine crackers and pretzels were my best friends, and that's really, really horrible for your teeth. Like, they're awful for your teeth. Try to drink as much water as you can after that so that you just take all that in and it doesn't get stuck on your teeth. Now, if brushing is an issue, brushing with your normal toothbrush makes you gag and actually vomit like it did me, or like set off a whole nausea attack, use a baby toothbrush. And me using a baby toothbrush was easier for me to get in the back so I can brush my teeth as best as possible, and it made the gag reflux a lot less. If the toothpaste is bothering you, the mint, the strawberry, whatever toothpaste flavor you're using, and you don't like flavors in your toothpaste, Risewell Pro has an incredible flavorless toothpaste that has been my best friend throughout my entire pregnancy. And even to this day, I really enjoy using it because it's really helping me with my postpartum sensitivity that I feel like I'm past right now, almost 10 months and a half postpartum. If you're not able to use conventional flossing or floss picks, you can replace it with a water pick temporarily. Water pick does not replace flossing. It's just something to do instead of doing nothing, to get some of the gunk out of there. If you fall asleep because you're growing a human and you are going to be tired and you're going to fall asleep some days without brushing or flossing and taking care of yourself, the fatigue is real. It's okay. Again, give yourself grace, and this is where having a dentist that you trust and feel good with is important. What I recommend is getting at least 2 cleanings during your pregnancy. It is completely safe to visit your dentist. Actually, it's not only safe, it's recommended by OBGYNs and dentists. The dentist has to be comfortable treating pregnant women. I recommend a cleaning at the end of the first trimester and a cleaning at the end of the second trimester. If you are a hot mess like me and you are sick your entire pregnancies, I was getting cleanings almost every single month so that I can keep the pH in my mouth. Okay, now I know I'm going to get this question. What if a pregnant woman needs treatment during her pregnancy? Ideally, we don't want to do any treatment during the pregnancy. But, for example, if she has an infection, like an infected wisdom tooth like we recently had in the office, a broken tooth, a tooth broken right in half that needs to be removed, a broken mercury filling, or severe pain on a tooth, or a really large cavity that got too big, you bet you we're going to go in and treat it, because the pain and the discomfort is going to affect the baby as well as the mom, and her mental health is very, very important during this time. We're going to be using a specific type of anesthetic that is deemed very safe. We're not going to use any epinephrine. Dental treatment on pregnant women needs to be done very mindfully and cautiously, but it is safe when done right. But ideally, please do your dental work before or after you're pregnant. So I hope you found this video helpful. Prevention is truly worth an ounce of cure. Do not be part of the 65% of women that encounters dental disease during their pregnancy or in the postpartum phase. So if you're planning on getting pregnant, are pregnant, or just had a baby, please take care of your dental health, because that is not only impacting yourself, but it's also impacting your baby, because we pass on our oral microbiome to our baby as well. So share this with any woman who you think would benefit from this information, and keep following along for more informational videos like this.